Welcome back to the second day of our workshop. We're going to be establishing effective patient navigation programs in oncology. So we're delighted that you've returned, or for those of you joining for the first time, welcome. We will be, as you know, live webcasting as well as archiving today's session. I want to especially thank our speakers from yesterday. What a great first day we had. We had the privilege of hearing from experts about navigation needs of diverse populations in the United States. We heard from Dr. Harold Freeman about the historical roots that have led to our current navigation programs. He described finding the right people to address the problems, but first finding out what are the problems. And he used the analogy of passing the baton in a seamless system to be able to navigate our patients and improve cancer outcomes. We discussed topics including the definitions of at-risk populations. Who needs navigation? We want to be able to address disparities and improve health equity. And how do we change cancer outcomes in diverse populations in both urban and rural settings? Our expert panels discuss specific navigation needs, such as cancer screening and pathways to timely treatment and palliative care. We reviewed a variety of roles in navigation, such as patient navigators, lay navigators, nurse navigators, and community health workers. And finally, we addressed competencies for education and training, and standards and metrics to measure navigation outcomes. Today, as my co-chair Larry Schulman said yesterday, we have to address the tough issues. Yesterday was the easy day. It was everybody celebrating what we already know and appreciate about navigation systems. But how do we address the cost effectiveness of navigation programs? How do we demonstrate impact and create payment models so we can develop and sustain navigation programs? Larry will be leading our first session today. And after that, we are fortunate to have a keynote presentation by Greg Simon from the Biden Cancer Initiative. And during our final session this morning, our panelists will discuss how we'll advance navigation programs that are sustainable and meaningful in a very changing healthcare reimbursement landscape.